Thank you, Beth. It's great to be here. Uh, I hope you're getting me. Thank you. It's a privilege to be here to speak about this very, very important issue. I see a lot of great people in the room. KG, Fofoji is sitting right here. And I remember those days, 2015, the first half of the epidemic. He went to Liberia several times in his role as the Assistant Director General of the World Health Organization. Thank you. Great to see you here again. And other colleagues in the room, Beth, and all of you that we worked together over the years, looking at this very important topic, the economics of national preparedness to fight against microbial threats. Part of my job these days is to live on a daily basis, seeing diseases, checking them so that they don't cause pandemic and cause disruption in the world that we saw in the 2014, 2015, 2016 Ebola outbreak. And so, next slide. Oh, I have it. Sorry. No, it's not here. Okay, so thank you. The thing is, in 2014, 2015, the West Africa Ebola outbreak had an economic impact. And Beth said it very well in the introductory remark that there were a lot of issues that happened because of the outbreak to Guinea, Liberia, and Sierra Leone. And somebody may ask, what do you mean by that, and what did really happen? The issue of cross-border trade was suspended, commerce and trade issues in Liberia and across West Africa. Schools were closed down, economic activities stopped, airlines stopped flying into the countries. We were isolated. Instead of isolating the disease, people were isolated during the outbreak. There were hospitals that were closed down because of the capacity of those countries to handle high, very, very high level pathogen like Ebola virus disease. And so some of the things that we did was to look at the economic costs. The World Bank looked at Liberia, and between 2012, the country was making a lot of progress. If you see Liberia pre-Ebola, and see Liberia post-Ebola, you will notice that the country was making progress with almost double-digit GDP. When Ebola struck, we saw close to 0.7% decrease down the GDP of our country. And today, it's still difficult for the country to recover from that outbreak. And so as you see, real GDP growth showed to 0.7% in 2014 from 0.8% in 2013, reflecting the twin shock of the Ebola crisis and lower commodity costs. Has been very slow up to now. Liberia is still having difficulties in recovering from the crisis. And there are frequent outbreaks of infectious diseases. Other colleagues were speaking about that this morning on diseases that we look at. Between January to December 2017, we've been battling measles, Lassa fever, emerging diseases like monkeypox. I listened to people were discussing this morning about re-emerging and emerging diseases, talking about what will happen if there was smallpox. Over 70 years, Liberia has not seen monkeypox, but in recent years, in the last year, we've seen cases of monkeypox. Meningococcal disease outbreak is something that we're also dealing with right now. And as you see there, the country profile of 4.5 million people, we've seen 39 outbreaks with 3 humanitarian events. And all of these things are having an impact on the economy of the country. I said earlier about monkeypox disease and what that could cause and that we're monitoring over time. Lassa fever outbreaks is frequent, about 33% case fatality rate. Over the years, this has been a serious issue that we are dealing with. The capacity we develop also in our labs and other areas. In April of 2017, we had an outbreak of meningitis, bacterial meningitis. Liberia is not in the meningitis belt. And so when this happened, it was a real scare. People thought it was reintroduction of the Ebola virus disease. And we were able to quickly ramp up root of Ebola and then make sure that we detected it with the help of the US CDC. Strategic planning for epidemic preparedness. In resource-constrained setting, the focus may be trying to respond of resources allocated, but national action plans are important to plan for this, and so we've done a strategic plan to incorporate One Health and other programs that deal with epidemics. And One Health is one of the critical areas that Liberia is making a lot of progress. And some of the benefits of the epidemic preparedness national strategy is to incorporate some of these multiple sectors that deal with some of the things that we're talking about. Tailoring on your global health security agenda, the JEE, Joint External Evaluation Program. Simulation exercises are things that we carry on all the time in our epidemic preparedness plan. Staff turnover is something, so you have to always train, do your rapid response program to do the integrated disease surveillance and response. And the JEE is one of the tools that we are using to do that. Financing of the plan, the national benefits that you get, we introduced the fee epidemiology program, which is working very well in some of our districts because you have to be preparedness is more important than spending all of those resources when there's an outbreak. And so training of fee epidemiology programs, county level, district level staff has been very, very helpful in our preparedness planning. Liberia has made progress with One Health, which is effectively coordinated. We have a platform chaired by our Vice President. There is One Health coordinating platform that we are very much keen on. We've done an assessment with the JEE and also the OIE tools for preparedness for animal and infection. All of those are linked to the global health security agenda and then linked to the JEE that was mentioned earlier, looking at national action plan for microbial resistance and develop also a tool for performance of animals' health and all of those things. So to date, we established and launched the One Health coordination platform. We signed a declaration, a commitment among all of the partners, the animal sector plan and human health. That is working very, very well. AMR, strategic operational plan developed. The Joint National Rabies Prevention Plan has also been developed that we're working on. The PVS pathway is one of the priority areas on our One Health approach, looking at vaccines for animals, medicine, looking at veterinary laboratory services, livestock officers training, looking at the Ministry of Agriculture, establishing officers at the district level, about 133 nationwide, county-based livestock officers are being looked at. So there's a lot of coordination between the One Health platform, animal, plants, and human health that have gained a lot. And so preparedness of services at the county level, at the district level, at national level can cause you to save a lot of billions of money that we use in the Ebola response during the Ebola crisis in our country. Thank you.